music, art, physical education and health. 9. Magandang morning, mga estudyante ng ESTI, PCIC, at ESE. We will now proceed with our lesson for today. Topics. Lesson 1: Community and Environmental Health Problems. What is community and environmental health? Characteristics of a healthy community. Community health problems. Lesson focus. The environment includes everything that surrounds an individual: the air we breathe, the water we drink and use, the land that surrounds us, all of the natural as well as human-made conditions that influence the quality of our lives. It also involves human interactions with the environment, which are complex and not always healthy. Environmental health is related to environmental science and public health, as it is concerned with the factors of the environment affecting human health. It includes the physical and biological factors external to a person. It aims to prevent and control diseases and to create a health-supportive environment. A healthy community includes aspects of human health, disease, and injury that are determined or influenced by factors in the environment. It is one that embraces the belief that health is more than merely an absence of disease. It includes those elements that enable people to maintain a high quality of life and productivity. Let's watch the video of community and environmental health.
Good day, class. Our topic for today is about community and environmental health. A healthy community reflects a sense of well-being. It is the foundation for the achieving of all other goals, and it is essential for a productive society. Thus, it also helps in building our country's economy and in equipping our students to be healthier in order to learn and succeed academically. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. It leads to a socially and economically productive life. When we say community, it is defined as a sociological group in a large place sharing one environment. It therefore includes the individual and the family. When we say community health, it is defined as the art and science of maintaining, protecting, and improving the health of all members of the community through organized and sustained community efforts. When we say environmental health, it comprises those aspects of human health that are determined by physical, chemical, biological, social, and psychosocial factors in the surrounding environment. According to the World Health Organization, the characteristic of a healthy community includes a clean and safe physical environment, an environment that meets everyone's basic need, an environment that promotes social harmony and actively involves everyone. An understanding of local health and environmental issues. A community that participates in identifying local solutions to local problems. A community whose members have access to varied experiences, means of interaction and communication. Accessible and appropriate health services and facilities. The promotion and celebration of historical and cultural heritage. A diverse and innovative economy, and a sustainable use of available resources for all. Our government believes that a strong nation needs healthy citizenry. In order to achieve this, the Department of Health promoted community health with the partnership of community, barangay, government, and non-governmental organizations through the program called Primary Health Care. The primary health care programs in the community includes: number 1, the maternal health care, which includes prenatal, natal, and postnatal. Number 2 is the child health care, which includes immunization and control of diseases. Number 3 is the nutrition program, which includes Operation Timbang and food supplementation. Number 4, the family planning program. And number 5, the control of communicable diseases. Number 6, dental healthcare programs, which includes tooth extraction. Environmental sanitation program. Control of non-communicable diseases. Reproductive health care, which includes counseling and family planning program. Medical morbidity clinic, which includes provision of free medicines. Voluntary blood services. Epidemiology and surveillance program, which includes controlling of outbreaks diseases. Disaster and management preparedness program. Mental hygiene, which includes adolescents counseling centers. And the last one is the pharmacy services. The above services must be made available for free in your community because they are subsidized by the government to ensure that your health is being protected.
Characteristics of a healthy community. According to WHO, a healthy community possesses the following characteristics: is physically clean and safe, has different and innovative economy, understand local health and environmental issues, promotes and celebrates historical and cultural heritage, provides accessible and appropriate healthy services and facilities, promotes social harmony, has members who participate in identifying solutions to local problems, enriches experiences through interaction and communication. A healthy community can improve people's health by increasing physical activity and reducing injury, increasing access to healthy food, improving the quality of air and water, minimizing the effects of climate change, decreasing mental health stresses, strengthening the social fabric of a community, providing fair access to livelihood, education and resources. B. Community health problems. 1. Water supply. The Earth's surface is 70% water, 98% is salt water and only 2% is fresh water or drinkable. Water comprises 70% your body. This is why water is important to your health. You can live for a month without food but only for a week without water. In households, consumers need substantial amount of clean water for drinking, preparing and cooking food, bathing, washing clothes, cleaning surroundings, and watering garden and house plants. Greater volume of water is needed for agriculture and industrial purposes. According to United Nations Water or UN Water, 783 million people do not have access to clean water, and almost 2.5 billion do not have access to adequate sanitation. However, water today is contaminated. Water pollution is due to the chemical, biological, and all sorts of physical pollutants that degrade the quality of water. Other contributors of water pollution are waste treatment facilities, mining, oil spill, animal wastes, and even household chemical like soap. Improper dumping of human wastes has also created water pollution. Sewage provides extra nutrients for rapid growth of bacteria and algae, which deplete the normal oxygen level in the water. If nothing is done, rapid eutrophication process occurs. Eutrophication is the excessive amount of nutrients in water. It is characterized by increased plant and algae growth or algal bloom that turns clear water to green. Two. Solid waste. This is composed of household waste, hazardous industrial waste, plastic waste, and e-waste. Community waste is classified into biodegradable and non-biodegradable. Non-biodegradable is more harmful to nature as it cannot be degraded. Hazardous waste poses greater threat to the environment. Plastic wastes top the list of pollution. Biodegradable waste includes any organic matter in waste which can be broken down into carbon dioxide, water, methane or simple organic molecules by microorganisms and other living things by composting, aerobic digestion, anaerobic digestion or similar processes. A non-biodegradable material can be defined as a kind of substance which cannot be broken down by natural organisms and acts as a source of pollution. Unlike biodegradable wastes, non-biodegradable cannot be easily handled. Non-biodegradable wastes are those who cannot be decomposed or dissolved by natural agents. Electronic waste or e-waste is the old or unused equipment, appliances, and gadgets. This poses lead, cadmium, or brominated flame retardants that trigger pollution. Today, e-waste has become a global concern and all efforts are made to minimize it. On the other hand, the improper and unsanitary disposal of human waste or excreta and sewage also threatens the health and comfort of people, especially in poor communities. Safe and proper disposal of excreta is essential to achieve a healthy community and to not contaminate the water, food, and environment. Three. Food sanitation and safety. This is the proper handling and keeping food to avoid contamination, storing perishable food at the appropriate temperature, and heating food to a temperature that inhibits the growth of bacteria. Here are the 4 steps for food safety. 1. Wash hands and surfaces frequently. Wash hand before and after handling food. Rinse fresh fruits and vegetables under running water before eating. Wash the lids of canned goods before opening. 2. Separate raw meat from other food. Make sure to keep raw meat and their juices away from ready-to-eat foods to avoid cross-contamination. 3. Cook the right temperature. Make sure to cook food in high temperature to kill harmful bacteria. Use cooking temperature chart. 4. Chill or refrigerate food properly. Refrigerate food quickly. Cold temperature slows down the growth of harmful bacteria. Do not overstuff the refrigerator. Allow for air to circulate. Keep a constant refrigerator temperature of 4.44 degrees Celsius or 40 degrees Fahrenheit or below. Let's watch the video of 4 steps for food safety.
4 basic steps for food safety at home. Each year millions of people get sick from food illnesses which can cause you to feel like you have the flu. Food illnesses can also cause serious health problems, even death. Follow these 4 steps to help keep you and your family safe. 1. Clean. Always wash your food, your hands and cooking tools. Wash hands in warm soapy water for at least 20 seconds. Do this before and after touching food. Wash your cutting boards, dishes, forks, spoons, knives, and countertops with hot soapy water. Do this after working with each food item. Rinse fruits and veggies. Clean the lids on canned goods before opening. 2. Separate or keep apart. Keep raw foods to themselves. Germs can spread from one food to another. Keep raw meat, poultry, seafood, and eggs away from other foods. Do this in your shopping cart, bags, and fridge. Do not reuse marinades used on raw foods unless you bring them to a boil first. Use a special cutting board or plate for raw foods only. 3. Cook. Foods need to get hot and stay hot. Heat kills germs. Cook to safe temperatures. Meat. Cook beef, pork, veal, and lamb roasts, steaks, and chops to at least 145 degrees Fahrenheit, 63 degrees Celsius, with a 3-minute rest time. Ground meat. Cook ground beef, veal, lamb, and pork to at least 160 degrees Fahrenheit, 71 degrees Celsius. Cook ground poultry to 165 degrees Fahrenheit, 74 degrees Celsius. Poultry. Cook all poultry to minimal safe internal temperature of 165 degrees Fahrenheit, 74 degrees Celsius. Use a food thermometer to make sure that food is done. You can't always tell by looking. 4. Chill. Put food in the fridge right away. 2-hour rule. Put foods in the fridge or freezer within 2 hours after cooking or buying from the store. Do this within 1 hour if it is 90 degrees or hotter outside. Never thaw food by simply taking it out of the fridge. Thaw food in the fridge or slow thawing, under cold water or medium thaw, and in the microwave for fast thawing. Marinate foods in the fridge. Thank you for watching.
4. Disease control. An epidemic is the occurrence of an illness that is clearly in excess of what is expected in a community or region. It demands for an immediate attention and control measures. Outbreak of diseases usually happens after natural disasters, particularly in developing countries. Most common diseases are diarrhea, leptospirosis, malaria, dengue fever, and influenza. These spread and increase because of unhygienic surroundings and practices, overcrowding, poor quality of water supply, and climate change. Interventions and programs to reduce morbidity and mortality are achieved by limiting the spread of diseases through the following: food security, personal hygiene, environmental sanitation, nutritional services, adequate supply of safe water, shelter and basic clinical care. Determinants and health consequences: unsafe water, inadequate sanitation and solid waste disposal, and improper hygiene. Improper water resource management and poor drainage. Diarrhea and vector-related diseases, malaria, snail fever, and dengue. Exposure to vehicle emissions and industrial air pollution. Respiratory diseases. Cancers. Exposure to toxic substances. Poisoning from arsenic, manganese, and lead. Let's watch the perennial community health problems.
Good day, class. Our topic for today is about perennial community health problems. Community health problems are common nowadays with the rise in a modern technology. People neglect the importance of the basic needs for safety. A safe environment will ensure a quality of life that will lead to more productive citizens of the country. This lesson will help you understand that one environment is threatened by human activities and that you have a role in wiping out the community health problems. Different perennial problems happen to the different regions of the country. Let us now discuss the different community health problems. Number 1 is a drug abuse prevention and control in the community. Substance abuse prevention, also known as a drug abuse prevention, is a process that attempts to prevent the onset of substance use or limit the development of problems associated with the psychoactive substances. Prevention efforts may focus on the individual or their surroundings. A concept known as environmental prevention focuses on changing community conditions or policies so that the availability of substances is reduced as well as the demand. Substance abuse prevention efforts typically focus on minors, children and teens, especially 15 to 35 years of age. Substances typically targeted by preventive efforts include cigarettes and various forms of smokeless tobacco, marijuana, inhalants, and other drugs. Another one is the alcohol, that includes binge drinking, drunkenness, and driving under the influence of alcohol. The next one is the water supply. A safe, reliable, affordable, and easily accessible water supply is essential for good health, but for several decades, almost 1 billion people in developing countries have lacked access to such a supply. A poor water supply impacts health by causing acute infectious diseases. It can also affect health by limiting productivity and the maintenance of personal hygiene. Strenuous efforts must be made to improve access to safe and sustainable water supplies in developing countries, and we should join with others in demanding accelerated progress towards global access to safe water. The next one is the food sanitation. Personal hygiene is important to prevent food poisoning. When handling a food, wash your hands thoroughly and often. If you are sick, do not go to work because you can contaminate food more easily. And food handlers should be properly trained in a safe food handling. Another one is the waste disposal. Community and public health works with local and regional councils to ensure that both solid and liquid waste is disposed in a healthy manner to prevent diseases. Waste reduction is something where we can all make a tangible difference. We can show love for our environment and our planet by living as waste-free as possible. The other one is the peace and order. Peace and order is an essential ingredient in maintaining economic development, social order, and political stability. A condition of peace and order facilitates the growth of investment, generates more employment, and attracts more tourists. Peace and order refers to the absence of hostility. It refers to an environment that is characterized by a healthy interpersonal and international relationship, acknowledgement of equality, and fairness. The next one is the control of diseases. There are many aspects to communicable disease prevention and control, all with the aim of preventing the spread of communicable diseases in the population. The work usually involves different types of preventive activities with the aim of: number 1, reducing the risk of an individual coming into contact with an infectious agent. Number 2, preventing individuals who have been exposed to infection from becoming ill. And number 3, preventing an infected individual from passing on the infection to others. And the last one is the human waste or the human excreta. This refers to the waste products of the human digestive system and the human metabolism, namely feces and urine. As part of sanitation system that is in place, human waste is collected, transported, treated, and disposed or reused by one method or another, depending on the type of toilet being used, by the ability by the users to pay for service, and other factors. People in developed countries tend to use flush toilets where the human waste is mixed with water and transported to sewage treatment plants. Community health problems vary according to factors like economy, politics, geography, culture, and social context. There are places which experience community health problems like waterborne diseases, armed conflicts, natural disasters, highly urbanized zones, and overpopulated areas. In this regard, the government has created an office which would be in charge of planning and implementing rules and regulations to address the above-mentioned community health problems. Let us always remember that a clean and safe environment is important in achieving a healthy community. Protecting the health of a community involves protecting the environment from health hazards. And as a student, you have a role in promotion of healthy environment, especially in your household, school, and community. This is your chance to help eradicate community health problems.
That would be all for our session today. Hanggang sa muli nating pagkikita. God bless you all. Let's explain. 1. What are the benefits that we enjoy in a healthy community and environment? 2. What does it take to live in a healthy community? 3. Mention 3 common consequences of pollution on human health. Let's connect. 1. How does the quality of our environment affect people's health? 2. When is a community healthy? 3. Which for you is the most effective way to control diseases at home, in school, and in the community?